Hello and welcome to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. Friends, in today's video, I'm going to talk about epilepsy in babies. Epilepsy in baby is one of the biggest reasons why parents observe delayed developmental milestones, cerebral palsy and other developmental related issues post their birth. So why are these epilepsy happening in your baby and what are the causes and what are the usual treatments for them? We are going to discuss that in brief today, so make sure to watch this video till the end. Let's begin. Well, what do you mean by epilepsy at first place? Epilepsy are, you can say, abnormal electrical activities that are happening in the brain. These abnormal activities can happen in different forms and which gives different types of epileptic attacks. But mostly there are signs that there are abnormality present in the brain which is causing this. This is a very typical indication if the child is experiencing epileptic attack. So epilepsy is at its highest risk when a baby is newborn and till the first year of the life. So when a baby is born, from that time till the first year of the life, if child gets epileptic attacks, then the chances of the repeat attacks increases, but at the same time the risk of developing epileptic attacks in first year itself is very high, and there are some reasons for that. So epileptic attacks basically happens in three group of babies or three different conditions or situations where baby can get this. Now number one is preterm or premature babies. Like if the baby is born before 37 weeks, then there are very high chances that the child is having or can have seizures or epileptic attacks. Second condition or second group of kids are the babies who are born full term, which means there was no problem before pregnancy, like they were not born before the ideal time, but during the process of birth there were definitely some injuries due to which child develops epileptic attack. And also babies who are born normally without any problem, okay, even they are at risk of developing epileptic attack between 1 month of age to 12 month of age. That means the first year of life. So these are the three conditions or situations where child can develop epileptic attacks. Now the problem that happens in the brain varies in each of these situations and will be the cause or root cause behind these epileptic attacks. So let's talk about the preterm individuals or kids. Now whenever a baby is born preterm or is before time, definitely the brain development has not happened, due to which the brain is very high at risk of developing hemorrhages, injuries, infections, etc. Whenever anything like this will happen, there is a risk of epileptic attack that will exist. Most commonly, hemorrhages and infection are the leading cause behind these epileptic attacks. However, the causes are not very clear. It is always mix of 2 or 3 things. Hence, it cannot be predicted, but seizures are likely. Hence, doctors have to take extra caution when a baby is born prematurely. Even in this time frame, it is difficult to spot an epileptic attack. Usually when a baby is sleeping or awake, they might get very subtle epileptic attack which goes beyond observation, but when EEG is performed, at that time doctors identify that there were epileptic attacks that were present. Now the second form of epileptic attack is seen in kids or babies who are born during their full term but have got some complications like structural damage. For example, if there is forceps delivery, vacuum delivery, there could be structural damage that can happen, due to which brain damage can happen and baby can develop epileptic attack. Second, metabolic disorders. If there is deficiency of calcium, glucose, magnesium in the bloodstream, at that time also there are chances of development of epileptic attacks. If the baby develop infection like encephalitis, meningitis, even that could lead to epileptic attack. And sometimes due to genetic conditions, genetic mutation disorders also would be the reason why a child can develop epileptic attack. Mostly children who are born full term and develop epileptic attack can get varying range of seizures. It could be gentle seizures, it could be clonic seizures. Clonic seizures are basically jerking movements or stiff stiffness that they develop over a period of time. It could be myoclonic seizures, where baby's upper body will suddenly jump forward and the legs will be twisted or bent towards the shoulder or towards the chest. These are a very typical sign that would be seen in myoclonic seizure. And the tonic kind of seizure, where the baby will stiffen his or her entire body and the stiffness will make an arch-shaped pattern. That would be also a very common form of seizure that would be observed in baby while he or she is born with some sort of injury or certain abnormalities post-birth. Now the third form is the post-birth or infantile seizure, or seizures that are formed post-birth. There were no complications during delivery or before delivery. Now in this situation, mostly infection or else trauma is the cause, or else metabolic cause like lack of glucose in the body, lack of magnesium and calcium in the body will lead to seizure attack. Even hypoxic attack, even if baby is born with the lack of oxygen, at that time also baby can show sign of epileptic attack post that. Hence it's important that care should be taken during the birthing process. Even in this time, clonic seizure, myotonic seizure, focal seizures and infantile spasms very easily are seen. These are all different type of epileptic attacks that are usually observed. Hence, as a parent, all I want you to tell is make sure to take care of your child and make sure to take care of proper observation of the child in the initial days, in the first year itself, especially if you have this history of some sort of pathology present before birth, during birth or after birth. Now coming to the management part, mostly epileptic attacks are managed with the help of medication. Medicines plays a very crucial role. Hence, first important step is identification. So keep a close watch on your baby. Are they showing some abnormal sign or not? If they are showing, make sure to take video recording of that entire activity and share it with your doctor so that doctor can identify whether this is an epileptic attack or not. It should not go missed. Second, if there are a risk or else if there are a chances, then definitely a doctor will suggest EEG test. EEG test will help doctor to identify whether there is an epileptic attack or not. Along with that, take care of proper nutrition immediately after birth. If baby is not getting enough milk that he or she needs, at that time epileptic attacks can happen. So if as a mother, if you are facing a lactation issues, if you feel that your milk is not enough for your child, please report it to your doctor. Your doctor will recommend some sort of formula which can be given to the baby initially to prevent all this kind of seizure attack. Make sure that your nutrition is taken care during the delivery, before delivery and after delivery as well, so that your milk production is good. You can pump your milk and store it, and then also you can give it to your baby. Your nutrition can save your baby from epileptic attacks. So that is very important. Now coming from a therapeutic point of view, stress sometimes could lead to epileptic attack after birth when the child is growing. Hence it's important that extreme temperature changes, extreme cold you should not kind of give exposure to the baby. Make sure to keep your baby warm, because immediately as the baby is born, right, they need warmth because they are coming from mother's womb, which is a very warm environment. And then suddenly when there is a lot of things happening like this and there are environmental changes, it can hurt your baby. So it's important. Unfortunately, from a therapeutic point of view, there are no major exercises that can help. So it's important that try to prevent epileptic attacks as much as possible. That will make a better difference than making or trying to cure epileptic attacks. No, it's not necessary that all child will develop epilepsy or else will have epileptic attack after one. It is not necessary. It all depends on the level of damage that has happened to the brain. So keep an eye on your baby if he or she has got one episode of epileptic attack also. So that was my key takeaway with this video. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.